Picking up new hobbies such as cooking is another manly way to avoid depression and reduce stress.
This is man therapy.
First, mash up 5 or 6 of these green things.
A service created by the Colorado Department of Public Health and Grit Digital Health to help prevent suicide in men.
There's still a lot of stigma and barriers out there that prevent men from wanting to talk about how they're feeling, and it leaves a lot of them struggling in silence.
Dr. Jody Fry, a professor at the University of Maryland, is working with man therapy to help get the life-saving message out there.
Why is it that men are so afraid to seek help?
I think a lot of men feel embarrassed. You know, the term just pull yourself up by your bootstraps is still alive and well out there, and men often feel like seeking help is a sign of weakness.
I'm Dr. Rich Mahogany. Visit me at mantherapy.org.
The creators say nearly 3 million people have viewed the character Dr. Richard Mahogany in the Man Therapy website.
You can't fix your mental health with duct tape. Giving men the tools to help themselves, to let them know that help's available, is very comforting.
Men are 4 times more likely to die by suicide than women. But a recent study funded by the CDC found that man therapy was able to decrease depression and suicidal thoughts in men. But it's not just suicide. In 2021, the difference in life expectancy between men and women reached 5.9 years, the largest gap since 1996. This is because men are also more likely to die from COVID-19, diabetes, and cancer than women. Some of this could be a result of biology, but there's also some cultural bias.
Men are not seeking healthcare in a preventative way.
Dr. Haider Varaj is a cardiologist and a proponent in men's health at Brigham and Women's Hospital in Boston.
Men are seeking healthcare when they're calling the emergency room or calling 911, and they're coming in for complications for disease.
His approach is simple. We need to rethink how we engage men in healthcare.
They're not looking to a doctor for health information. They might be looking to a podcast. They might be looking to a website. They might be looking to their church or their social group. And so we have to make sure that we engage with all of those partners.
Whether looking at medicine in a new way or visiting Dr. Mahogany at Man Therapy, it's time for men to take their health seriously.
All right, so let's bring in Dr. Akshay Syal. So you talk about how we need to rethink men's health care. What is it that men should be doing now to get their bodies and in part, I guess, their minds, too, right on the right track?
Yeah, so there's a couple of things going on here. You know, one, there are some biological factors. We know that estrogen, the hormone largely found in women, we know that can be protective against heart disease. But that's not the whole story. There is some cultural bias, and it's men just don't want to go to the doctor. I mean, I can't tell you how many people, or how many men I've had in my office who say, you know, Doc, I'm coming in, I have this chest pain when I exercise. I think I'm fine, but my wife wants me to come in. And it's that key line. It's really oftentimes the women in their lives that are driving them to the office. So what can we do about it? You know, there's a couple things. The first thing, now with telehealth, we've seen telehealth kind of expand with COVID-19. If you don't want to make it in, if you're too busy to make it into a doctor's office, try a telehealth appointment. It's better than nothing. It can get the conversation started. And if they notice some things that they want to see you in the office, that, you know, that's something you can expand to as well. The other thing, bring friends and family, bring loved ones to the visits with you. We really need to get those in-person visits going, because there's some things that we can pick in, like taking your blood pressure in an office, that we can't really do at home.
And mantherapy.org, that's a real organization. Dr. Mahogany, not a real doctor.
not a real doctor.
But very relatable, and it's working.
It's working. There's a CDC-funded study showing it's working. Check it out, mantherapy.org.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.